In part one of this two-part series, we shared some information with you about what autism spectrum disorder looks like in children, signs to watch out for, and how doctors and schools identify and diagnose autism. In part two, we want to share a little more information about evidence-based interventions for the symptoms of autism, things families can do to help children with autism at home, and also how schools and other therapists work to support students. We'll share some additional resources at the end of this session that we hope will be useful. Behavior analysis is a science that studies how the environment affects the behavior of organisms. Applied behavior analysis is applying that knowledge to everyday life. ABA therapy is most commonly used in working with children with autism, but it can also be applied in mental health, education, health and wellness programs, gerontology, and in the treatment of substance abuse, to name a few other areas. ABA therapists work with everything the child does, not just undesirable behaviors. Their main focus is helping children to gain skills in communication, socialization, and other daily activities like sleeping, playing, eating, and going to the bathroom. ABA focuses on teaching children the skills necessary for them to interact at school, at home, and in the community. If a child has issues with sleeping, eating, or with learning how to use the bathroom, it's very important for the doctor, therapists, and parents to work together to help rule out any medical problem before using ABA or any other interventions. Getting as much information as you can about autism spectrum disorder, ABA, and other interventions will help you to understand your child's options and work to figure out your next steps. To move forward with getting ABA therapy, you can start by making an appointment with your primary care provider, family doctor, or pediatrician. There are several agencies in Northwest Arkansas that offer ABA services, and your child's doctor can make a referral to the agency that you choose. You'll need a copy of the report from the evaluation that diagnosed your child with autism. Clinics and agencies that provide ABA therapy often have a long waiting list, so it's really important to speak with your doctor as soon as possible if you have any concerns. ABA therapy can be provided in the home, a clinic setting, or in schools. Occupational, physical, and speech therapies can be very helpful for children who are diagnosed with autism when therapists work together with the ABA program. The occupational therapist can work with sensory processing difficulties and fine motor skills. The speech-language pathologist can provide support in learning communication skills, and the physical therapist can support development of larger body movements. An evaluation at the therapy clinic helps to decide if a child qualifies for these therapies, and the intervention plan that is developed will be based on your child's specific needs. Each therapy clinic has their own approach, but all have to comply with Medicaid rules for billing and services for children who have Medicaid. Schools provide these therapies if a child qualifies based on educational criteria, and children can receive therapy both in the clinic and at school if parents choose. You can ask the school not to bill Medicaid for school therapies if you would like your child to also receive therapies in a private clinic. Children with autism learn differently from typical children and need strategies that are specifically developed for them. When OT/PT and speech therapists use the principles of behavior analysis, this can help the therapy to be more effective when working with children who have autism. There are many clinics in Northwest Arkansas that provide these therapies. Talk with your doctor about your concerns and see what they might recommend. You know your child better than anyone, and your observations and opinions are part of the critical information that any medical or educational professional will need to be able to help. If you don't receive a call from a doctor, therapist, teacher, or other professional, it's okay to call them. It lets them know that you're interested and that your child is your priority. Writing down questions before appointments and meetings helps you to remember them and leave with the answers you need. This can help you to be an active member of your child's team. If you need to find resources and services, it's a good idea to visit the agency or call to ask about what they do. Sometimes it takes extra persistence to find the right person to talk with. Doctors and therapists may come and go as children grow and move through each phase of development, but you are the constant in your child's life. There are ways that families can help children with autism at home. If possible, it's best to work with the help of an ABA therapist and a certified behavior analyst. That's the person who develops the ABA treatment plan. These professionals help to assess and teach the sequence of basic skills your child needs to develop in order to learn more complex skills. Behavior change doesn't happen overnight. Before you can get access to ABA therapy, here are some basic things that you can do to support your child. One is to create a daily routine, which helps your child to know what comes next each day. Being consistent helps children with autism to have a better understanding of what they're expected to do. Creating a safe space in your home can help your child to de-escalate emotionally and feel more secure and calm. Letting your child know when it's time for a change can help them prepare to end one activity and begin another. This can be done by using timers or verbal reminders, for example. Some children with autism can benefit from using visual schedules, picture sequences of tasks, and social stories. We mentioned the challenges that children with autism may experience with communication. The therapist can work with you to teach you strategies to make your child's daily interactions more successful. It's better to observe therapy sessions if possible so that you can see the therapist demonstrating what to do. Here are some tips that can help you to support your child's work to communicate. Use clear and literal language. Children on the autism spectrum often have difficulty understanding long, complex sentences and words that have more than one meaning. Give your child more time to process information. Children with an ASD diagnosis often need more time to process what people say to them. Sometimes when it seems that your child doesn't want to respond, it may be they need you to wait without saying anything so that there's more time to think and answer. Use basic and concrete language. In moments of frustration, children who are diagnosed with autism may respond better if parents use fewer words and physically show them what to do or where to go. Observe to see if your child uses nonverbal cues. If they don't wave goodbye, clap their hands, or show emotions with facial expressions, remember that this can impact their ability to express themselves and understand other people's communication. Supports at school depend on your child's strengths and needs. The school should work with you and take into consideration any information from medical professionals that you work with. Keeping school personnel, therapists, counselors, and medical professionals updated about the services and supports your child receives can create opportunities for collaboration. Being diagnosed with autism doesn't automatically mean that a child needs special education services, but students who are diagnosed with ASD often need some support. Schools can provide a range of services, and school personnel should find the program that supports each student to get their education and be a part of the school community. A 504 plan supports students in the regular classroom with their peers during the school day, with accommodations. This plan is designed to protect students from any form of discrimination because of their diagnosis of autism or any other limiting condition. The school should monitor the student's progress very closely to see if the plan is working or if changes need to be made. For older students with autism, the heavier academic load and more complex material can quickly cause stress and frustration levels to rise. If the plan's not working and the student is not making progress, the school team needs to act quickly to make changes that can help. The 504 can include a behavior analysis followed by a specific behavior plan if problem behaviors are affecting your child's ability to function in the classroom. If the 504 plan isn't working, it's time for the team to take another look and see if there are other accommodations that your child needs. The team may consider making a referral for a special education evaluation to look deeper into what may be causing academic struggles, and to see if your child qualifies for special education services. It may be that there is another disability in addition to autism, such as an intellectual disability or some other learning and thinking difference that is impacting learning. To start the process, the school team usually observes the student and talks with parents to ask about their observations and concerns. To make the decision about whether or not to evaluate, they invite the family to a referral conference. At the meeting, the team will decide if there's enough evidence to recommend a special education evaluation. Families can ask the school for a referral conference if they have concerns. If the team decides to do an evaluation, parents will be asked to sign a consent form. Then the school psychology specialist and other qualified staff will administer assessments that are designed to help them understand the student's academic, social, and communication strengths and needs. If the school administers a special education evaluation and the student with autism qualifies, the team will develop an individualized education program, or IEP. Parents are a very important part of this group and must be invited to IEP meetings to participate in the conversation and decision-making process. Because children who are on the autism spectrum learn differently from typical children their age, it's very important that teachers work with them using instruction, communication, and reinforcement techniques designed for students who are identified as having autism. Schools should provide training and information to teachers and staff so that they understand clearly how to support the students. As we mentioned in Part 1, Arkansas Support Network, the Division for Children and Families, offers applied behavior analysis therapy, care and training homes, and information and support through our Family Support Program. Please contact us if we can help, and as always, our services are free of charge. Here are some additional resources about autism that you may find useful. These are the online resources that we shared in Part 1, in case you'd like to have them all together. You can also find a link to all the resources in the description of this video. Thank you very much for your time. We hope the information in Part 1 and Part 2 of this presentation about ASD has been helpful to you. Please let us know if we can be of assistance.